So I wanted to say welcome to everyone. We're so excited to be able to host this conversation this morning about childcare and the impact on our local workforce. This has certainly been an issue that our chamber has been concerned with for quite a while. I think it's a conversation that we've had across our community. Certainly it's a national conversation we've been following as well. I think most of the panelists on this call would agree that this is not an issue that is come about because of the COVID crisis, but it certainly has been exacerbated. Some of the challenges that our childcare services are facing after or post-COVID are extremely challenging. So as we look sort of for the Q&A portion of this, we do invite you to start thinking about maybe some of the questions or share a little bit about some of your experiences as an employer in the workforce as it relates and both sort of pre and post the crisis we find ourselves in, because we know that the child care issue is something that has been on all of our minds for quite a while. So with that, I just have a few slides to go through. I'm sure everybody is familiar with our webinar logistics at this point, but if you could, with the exception of our speakers, excuse me, just mute your microphone to reduce our background noise while you're not talking. If you're able to, go ahead and edit your meeting name so we can see your first name. It just makes it a little bit easier if we do question and answer. This, as I mentioned at the beginning, this webinar will be recorded and we'll be sending it out to our folks afterwards. And we will have time for questions after our panelists just have a few comments each. So we do want to leave ample time for Q&A. You can utilize the chat box if you're more comfortable with that, or you can, I think we'll be small enough that you can go ahead and unmute yourself to ask questions or share a little bit about your personal experiences. I wanted to just share a little bit about what our chamber's been doing. From the very beginning, we have had a resource guide for our business community. Now it's really focused on some of the reopening resources that we've been compiling, so make sure to check our website for those. I did want to share a little bit about a new program we rolled out last week. This is for businesses to be able to access PPE and cleaning supplies, so you can reopen your businesses safely. So we've heard from many of our members that access to some of these supplies has been really challenging. So we wanted to partner with a local provider and make sure that we had plenty of stock to be able to share widely across our community. So log on to Stay Safe Dayton to check out a little bit more about that. We've been doing lots and lots of webinars. So if you have a chance when you log in to maybe check out this webinar, there'll be other ones that you can take a look at if any of are interest to you. And then, as I mentioned, we've got lots of services, particularly for businesses as they look to find some help with their reopening procedures. So make sure to check your member hub account for that. So with that, I mentioned our agenda this morning, but we'll have 4 panelists on the call today. And then we'll be having time at the end for a little bit of what we're calling employer testimonial, employee testimonial, and Q&A with our panelists. So be thinking about maybe some of those questions or comments. And then with that, I'd like to briefly introduce and welcome our speakers. We have Commissioner Carolyn Rice on the call. We have Robyn Lightcap on the call this morning. We have Julie Thorner, and then we have Lynanne Gutierrez. So I want to welcome all of them. And with that, let me go ahead and turn things over to Commissioner Rice. Commissioner, welcome.
Thank you. And thank you to the Chamber for hosting this webinar on what I think all of us on the call think is a very, very important issue. And hopefully we'll be working together to solve it. You know, as a county commissioner, the children's from birth to 3 has truly been one of my areas of focus. And I've always cared deeply about it, but the science shows that these early years are so vital for children to get off to a fantastic start, both emotionally, socially, physically, mentally. And so we've really been invested, the county's been invested, and many of the stakeholders on this call in really upping the quality of care and making access for um, families who need child care, for that to be high quality. And we've really been on a roll, but we've always known that the profit margin in this area is very narrow, it's skinny. But we're making progress, and then the pandemic comes. And what it has really shown, it has really tossed this very important sector into a tumble. Many could not even be open. It just wasn't feasible for the essential workers, because what it's really proven is that childcare is essential to essential workers. And, the governor very wisely has enacted safety precautions for all kinds of businesses. It's just opening, this childcare is just opening up beyond the pandemic licenses, I believe, this week to other workers. And that is critical. If they are going to return to work, they need to know that their children are safe. And we want the child care providers to be safe. And so the whole world is for all of us, but especially I think the county's very concerned about the child care programs in our area. And I'll let the other speakers talk about the details of why it's going to be such a challenge moving forward, and necessary, but we all have to come together to do that, because I see it not only very important for the children and families, but it's an economic issue. And this situation has really shown that. If we are to come back as a strong economy, we are going to need to assure that every worker has access to childcare, which I am concerned that may not be the case, and that not just childcare, but quality childcare. So we cannot relent in our efforts to really support child care programs and helping them to improve their training, their staffing, the curriculum. We don't want to lose ground. So the problem is, as you already mentioned, has been exacerbated. So I just stand here in behalf of the county. We are very concerned about this. I am certainly ready, and I know the other speakers will talk about some of the potential things that we need to advocate for, but I just am excited to hear from everyone, to connect with leaders in the business community who share these concerns. I think we need to join forces as we make the case to both our state and federal legislators of not only how important this is, but what we need to correct this situation. And not just now, but moving forward. We cannot lose sight of the goal. If we are to succeed for many years to come, our children need to succeed from the beginning, because if they succeed and get all they need at these young ages, then our preschool promise kicks in, and that prepares them even more for school. If they succeed in school, then there are better workers and into adulthood. So that's why I'm here. I care deeply about this issue. I'm excited to hear from everyone else, and thank you, Chamber, for giving us this time.
Great, thank you, Commissioner. I appreciate your being here this morning. Robyn, I'm going to go ahead and turn things over to you to kind of provide an overview of the landscape, particularly in our community. Did you have slides that you wanted to share? Because I can give you control, or did you just want to talk? I think you're still muted, Robyn.
Can you hear me now?
Yep.
Okay, I think I'm just gonna talk, and then if we decide we want to pull up a slide, I might send something to you, because I'm doing this from my phone. So thank you everybody for taking time to listen, to hear a little bit more about childcare. And I want to thank Commissioner Rice in Montgomery County, because Montgomery County has funded for over a decade now investments in having an early childhood collaborative. And that is what led to our Learn to Earn Dayton initiative and to Preschool Promise. And so we are really fortunate that the county has invested in non-pandemic time, so that we're in a place now that we can have some coordinated support. But what I would like to do is just give you a high-level overview of what the situation is with childcare in our region, and then we're going to ask Julie Thorner to give you a real-life example as a childcare owner about the decision she's having to make. So back at the end of March, you all might recall that the governor, one of the very last businesses to close was childcare. And it is because it is so critical in supporting the workforce and in educating our young children in the most vital time of brain development. So it really plays, childcare plays this dual role of education and workforce support. So at the end of March, the governor gave an opportunity for childcare providers to apply for a temporary pandemic license, and they must operate under significantly reduced group sizes or classroom sizes and have far fewer people in a classroom, which is the main economic driver of how the childcare businesses survive. So obviously that was super challenging. The state originally said they would pay for tuition assistance for all essential workers. And then a couple of days before the programs opened, they said they would only pay for the lowest income families who needed childcare during the pandemic time. So they also changed the ratios and group sizes at the last minute, which is totally understandable because our governor has taken a very wise and strategic approach to making sure we're keeping people safe. And so I really respect the governor's leadership on that. And at the same time, we have to acknowledge what that means for the finances for childcare if we want to help them survive. So the pandemic programs, to give you a feel, in Montgomery County, we have about 300 licensed childcare providers, and we had about 70 programs in Montgomery County that applied to do the pandemic childcare starting at the end of March. And about half of those are family childcare providers, which means they can care for up to 6 children in their home. So pretty small providers. And we had about 800 to 1,000 children of essential workers that were in the pandemic childcare sites over the last couple of months. And as Stephanie mentioned, the governor has given the okay for childcare to open starting next week. And this is a good step forward in getting more workforce support. However, we still have significantly reduced classroom sizes. So if you think about a typical center that might have an infant classroom, a toddler classroom, a couple preschool classrooms, school age classroom, they typically might serve 100, a little over 100 kids. Under the new regulations, that same center is limited to only serving about 39 kids in the program. So it's less than half of their normal capacity. There are some possibilities depending on the size of the program that they can put in temporary dividers, but obviously that's expensive and you have to have enough room. You still have to meet strict guidelines about square foot per children on each side of the divider, and you have to follow hand washing and different requirements. So dividers don't work for all of our providers. And so the point here is that we will see significant reduction in the capacity of childcare providers in our community. And of course, we don't know yet how many families are ready to return to work and need to have childcare. Obviously, I am very concerned about our lower income families who need to be at the physical office building or at McDonald's or out at the hair salon. You cannot work remotely in those positions. And so they must have childcare. And obviously we have less than 50% capacity happening in our childcare programs. We do think that the state will be releasing a grant that will help for about a month. We're not sure yet how long it will help, but we are still waiting for the details on the grant. And the childcare programs are opening on Monday. So this makes it very challenging for our childcare programs to set tuition rates because they don't know what assistance is coming from the state. They also are still waiting for the emergency rules, which is all of the detailed guidelines by which they must operate. And again, opening on Monday. And so we're definitely down to the wire on providers figuring this out. What we anticipate is that providers will be increasing their private pay tuition rates because they have to. There's no way around it. Because if you have less than 50% of your income coming in, but you still have more than 50% of your expenses, which is definitely the case, because in order to run these programs in a safe and COVID-19 manner, we've got to make sure we are appropriately staffing the rooms. So this is the reality. And so if you start to hear from your employees that they are struggling with childcare, this is why. And I know I've talked to some folks who are struggling to pay the increase in the tuition as well. And these are realities that we face. So when we get to Lynanne's portion, we really would ask that you all lend your voice to the cause, because we need more federal investment to sustain childcare in this COVID-19 safe, lower classroom size manner if we want to keep our childcare providers going. So that's a broad overview. Again, thank you to the county. We were able to provide some tuition assistance to essential workers during the pandemic through our Preschool Promise initiative. But as we get into this next phase, we don't have tuition assistance available for the masses. And so that's why this, the idea of how you can support your employees and how you can support the increased state and federal investment is really critical. So I think, Stephanie, I don't know if you want to introduce Julie, but I think Julie's up next, and she can really bring to life what this looks like from a provider perspective.
Great, thank you, Robyn. And yeah, we're really thrilled to welcome Julie Thorner, who's president of Mini University, one of our chamber members, and also really a model for childcare in our community. So Julie, I want to welcome you and would love to hear a little bit about your experience during this time.
Thanks, Stephanie, and thank you, Robyn and Commissioner Rice. I could be just nodding my head and saying yes, yes, yes. Everything they've said is exactly the reality. Unfortunately, quality seems to be being redefined only as low ratios, disinfecting everything, which of course no one would ever want children to be in an unsafe or dirty environment. But it goes so much beyond that. We have 5 centers here in Southwest Ohio, 4 in the Dayton area. 3 are preparing to open on Monday. 1 will hopefully open in the Oxford community in July. And the 5th one, we're not sure what will happen. So it's just the reality. Robyn's exactly right that less than 50% capacity is really going to be the key problem for businesses. You know, my own business, we have employees who bring their children to Mini University centers. So they haven't been able to come to work to help clean and prepare, just like I'm sure many of your businesses, that employees who don't have childcare can't go to work. And Robyn's exactly right. The lower the income, the less likely that group of employees can work from home. And I think, unfortunately, we've made assumptions that most workers can work from home. It's just not true. Lots of people can't. They have to be on site, and especially in the service industry like childcare. You know, it's this blend of service and, you know, kind of the workforce behind the workforce and education. All of the early learning and the progress we thought we had made around what happens with brain development for young children before they kind of enter formal school, kindergarten. I think we've forgotten about all of those benefits. So now we've had children at home for a few months or in some other kinds of environment. There's going to be a fair amount of trauma just involved with their re-entry. So those are very real factors. I think for workers and for families, employers and for families, the reduced capacity is really the #1 issue. I think the funding side of it, yes, we've implemented an increase. We maybe, you know, we're a little ahead of the curve that we had planned to do that. We had planned to kind of have a rolling fee increase. So now that's a more dramatic, immediate increase. And any previous discounts that we could offer, those have had to be discontinued here during the pandemic. So it's significant. You know, childcare is expensive because it's so labor intensive. And then you add all the new regulations and it's even more labor intensive. So For example, a classroom might open, if a center, many centers are open from 6 in the morning till 6 at night. Families who work an early shift drop off their children, and usually you might have young infants, babies and children in diapers in one room, and you might have preschool in another. And then as children enter the building, then new classrooms kind of start out, kind of open up. Under the new regulations, we're assuming, again, we still haven't seen them, and that is making this especially difficult. But every classroom, when it opens, you'll have to open more classrooms. There's reduced staffing because of the lack of contact. They want only one teacher per room. Personally, I don't think that's very safe. We've always had a model of 2 teachers per room. But we're not going to be able to afford to do that. So now we have teachers and assistants who perhaps have less education, alone by themselves with a smaller group of children. But it's just, whether you have 3 or 4 babies by yourself, that's still a lot. It's just nicer to have more adults around. So more classrooms open. It's a very inefficient staffing model. Then you've got people who previously worked full-time shifts, now working part-time shifts, just again to try to make the numbers work. This is a break even at best, and that is really by placing the burden on families. And families shouldn't be the only ones supporting this, funding this. Again, I'm very grateful and blessed to be part of Montgomery County and part of Preschool Promise, so we're one of the lucky ones. But there's a lot of providers out there who won't even reopen. That'll be the first, 20 to 25%. Based on a state survey, it already looks like about that many won't try to reopen for a while. And then the reduced capacity, it's going to be a dire straight situation. And then what will families do if they don't have childcare? They won't be able to go to work. So it's really a difficult situation.
Thank you, Julie. I appreciate that. And so I'd like to wrap up our opening comments with Lynanne from Groundwork, Ohio. Lynanne, I know you've been really focused on the policy work at the state and federal level. So we'd like to hear a little bit about the landscape and some of the initiatives you've been working on.
Thanks, Stephanie. Well, it's nice to hear from you and see some of your faces, Commissioner Rice. I haven't seen you since COVID, so thankful for your leadership, which is certainly always a beacon in terms of early childhood across the state. I do just want to kind of affirm all of Robyn's comments and Julie's experience as we talk to providers and local communities across the state in terms of what we're facing. And really, if you take kind of one piece home in terms of capacity loss, the Center for American Progress at the national level, which is in line with some of the local data you have, estimates that Ohio is going to lose 45% of childcare capacity. So 45% of SLOSS, of those children who currently have access to childcare, will not have access to childcare without some very serious and urgent intervention. And so our role at the state, I should have introduced myself. So I'm Lynanne Gutierrez, and I'm the Policy Director and Legal Counsel at Groundwork, Ohio. We are the statewide advocacy organization for early childhood. So childcare is a lot of our work, but not the only part of our work. We advance early learning and healthy development strategies in the first 5 years of life, so prenatal to age 5. But childcare has been a real priority always of our organization, and certainly during COVID, because it's just the most immediate kind of capacity loss, and really the largest program in the state, and that's at the community level, where kids are accessing high quality intervention. At the state level, our advocacy has really been focused on preserving and protecting all state investments that are current in childcare. And it's not a very fun job as an advocate, really, because we continue to see state revenue drop. We have, as a childcare system statewide, we're very reliant on federal funds. So our state GRF, most of the state investment is tied up in our federal funds, our federal maintenance of effort requirements. And we have a small amount of funds that are reliant on state casino dollars. You can imagine those won't be there going forward. So we're already facing real losses, not to mention the kind of anticipated agency cuts that the governor was asked to make. We haven't seen the line by line for fiscal year 2020, but we're already obviously looking at fiscal year 2021 and what that brings, and then we'll have a new state budget at the beginning of next year. So in terms of state revenue, we are very limited by the tools that the state has. So Groundwork has really pivoted our focus to federal advocacy. So there's lots of work and kind of protection and preserving of our system, certainly of the quality system and the policies that our state has invested in for more than 2 decades to kind of get where we're at right now. But the state does not have the tools to get to kind of the level where we can begin to respond meaningfully to the capacity loss. So the grant program that's anticipated to help programs like Julie's, it will fund part of the gap between pre-pandemic funding and these new operations or these new operational assumptions, but it will fund part of it for a very short period of time. So a month, yes, maybe they can squeeze more than a month out of this, but we have been working feverishly to try to get more money from Congress directly into childcare. So there's currently an ask at the national level for $50 billion national investment in childcare. And the House most recently passed the new federal stimulus package, the HEROES Act, and it only had $7 billion for childcare nationally. So the CARES Act dollars that our state saw, that was a $3.5 billion national investment. So certainly $7 billion is appreciated, but we're talking about getting us a few more months, squeezing a few more months out. And we really know that depending upon how long the new kind of operations or the new restrictions on group size and staff to child ratios are going to have impacts longer term. And we need to really be prepared for both the 3 to 6 months reality, but also the next year and beyond in terms of stabilizing the child care system. So the national ask has kind of been reasserted as the HEROES Act is now in the House. Is now in the Senate. So most of our advocacy within the next couple of weeks will be focused on Senators Brown and Portman to try to get them to increase that amount in the Senate version of the HEROES Act. Meanwhile, back in the House, we're still trying to cultivate support so that when there's another conversation around the HEROES Act in terms of childcare, that there will be, I guess, greater support for a larger investment. There is a representative from Massachusetts who is, we anticipate to drop a bill for the $50 million in childcare. So again, we'll be asking our congressional delegation to support that. So I think that we have always kind of been trying to build relationships with business communities across the state and the chambers to first lend their voice to the policy and advocacy for childcare and for other early childhood interventions. And certainly we'll need that now more than ever. I know that every industry is really hurting, but adding childcare as an integral part of the kind of the list that you go to your local, state, and federal policymakers will make a difference in terms of what we're able to accomplish as a community. And again, with that focus on federal advocacy right now, one way that I think would be an easy kind of first step to do that is if you aren't already signed up for our newsletter, you can go to groundworkohio.org. We have weekly opportunities and action alerts for you to spend 3 to 5 minutes with us to send a letter to your congressman or senator. It could be a phone call. It could be engaging in social media. We have different tools that we are staging each week. This is a marathon. not a sprint. And so we're just trying to ask for 3 to 5 minutes of your time every week to engage very quickly with us in a very easy way, to build a type of quantity of and large voice to be elevated out of our state. So we're doing our part in terms of the national landscape on childcare. So please engage in those opportunities. And of course, we would be very interested to continue help building deeper relationships with many of your local businesses. So certainly the leadership of Robyn and the county leadership and your local businesses has been fantastic, but the more we can bridge that to state advocacy and federal advocacy, we're happy to do that. And I think lastly, this reminds me of some time I spent with Stephanie long time prior to the pandemic with the U.S. Chamber of Commerce Foundation. But we all are really having to reimagine what the childcare system will look like, and it's going to require really creative and innovative and strategic thinking, and that requires business minds and advocates alike. And so there are many things that you can do if you're interested in terms of adopting internal policies or doing things as your own business to ensure childcare for your particular workforce. So it's really on a continuum of how kind of deep that commitment for you may run based on the needs of your employees. But beyond lending your voice and support of these advocacy efforts, certainly working with existing childcare providers to contract or prioritize spots for kids of your employees, establishing on-site childcare centers, or really just evaluating the type of benefit programs you have for your employees to help stabilize those families that work for you and the other businesses, childcare businesses in your community. So there's many ways to do that, and we'd be happy to support you exploring some of those ideas during the pandemic and beyond. I'll stop there.
Thank you, Lynanne. Appreciate that. So we'd like to open it up to the folks on this call. We'd love to hear from you as employers. I know we have both large and small employers on the call. I know we have some providers on this call. I know we have lots of parents on this call. So if you'd like to talk about what you're personally experiencing. But yeah, we'd really like to open up the floor. So if you have questions or comments about how this current crisis is impacting your childcare plans, you can type it in the box, or you can go ahead and unmute yourself, but we'd love to hear from you.
So I have a question for the Commissioner. Hi, Commissioner Rice. We have this wonderful resource of Wright-Patterson Air Force Base here, and of course it's in Greene County, but we know a lot of our military folks live in Montgomery County. I am speaking from personal experience right now, a grandma of 2 little ones, and my son-in-law is getting ready to deploy. And that's causing great concern for my daughter, who is an essential worker, and just learned this morning that she's losing her plan for the summer to care for the kids. So I'm just wondering, Commissioner Rice or anybody, what the impact of the base and families who deploy and what kind of pressure that's putting on our child care system in addition to the essential healthcare workers.
I have to admit, I honestly don't know, but that is something that we can look into. I don't have the answer.
I can speak just a little bit. Our personal experience, one of our locations is at Wright State University. And so there's a very large military population there. And we've been surveying our families throughout the temporary closure. And that is the group of families who really have been most in need. It is dire. So we're doing everything possible to serve as many of those families as we can, but the military child care system, which is under kind of federal regulations, they've also shut down. They did, I think, collapse into one location on base and are kind of slowly starting to reopen, but they're in really a very similar situation as we are, that there's just not enough capacity.
Thank you.
Anyone else?
Stephanie, can you hear me? This is Gail.
Yeah, go ahead, Gail.
Good morning. I've had the privilege to work with both the Chamber and with Robyn closely with a lot of the providers. And Commissioner Rice, I was wondering if the CARES Act is going to be an option for the early child care providers, the big grant that's going to be coming out hopefully in June.
I have been we are announcing we have a new Office of CARES Act, and they are standing up a program. We are going to be we've already received $92 million for reimbursement of costs associated with COVID-19. Part of that 92 million, I believe, is going to be a $40 million small business grant program, I understand. And it has not been announced. I think it'll be mid-June when that is announced. But I definitely advocated that child care centers, child care programs would be eligible for that. And I was assured that they would be eligible. I don't know, what I know I believe it's going to be for employers with 30 or fewer employees. And I don't know any of the rules of the program. I am anxious, fighting, just wanting to get that information out so that we can help with, being able to insert $40 million into our local economy to help these small businesses. We hope will be a real boost in the arm to the local economy. And I definitely want child care programs who are eligible to benefit from that as well. And I'd be glad once that is finalized, which should be in the coming weeks, because this is going to be a heavily audited program. So we have to make sure that we're dotting every I and crossing every T before we announce what the rules are for it. But I'd be glad, Stephanie, to share that with you and this whole community here. And we will be promoting it widely. 40 million sounds like a lot, but how quickly, when the need is so great, that it will, I'm sure, not be enough. So I hope that answers your question. Yes, child care centers who qualify will be eligible.
Thank you so much.
This is Tosin Oshubumi. I have a question for Commissioner Rice. How are you? With the county opening up on Monday, what are your plans for employees that still needing like childcare help?
What are we planning?
Yes, I know with employees coming back now, I know some of us, which is very good, we've been able to work from home. Are you still going to be flexible with allowing employees to work from home and maybe come in, work with their directors and supervisors in terms of coming in to work and working from home?
Yeah, each of the elected authorities is setting their own rules. Okay. Those employees within the BCC, we are working with each of the department leads. Unfortunately, we're like other employees where some of our employees absolutely have to come to work. So we are living this same problem as others employers in the area. So we're in it with you, but we're also making investments in the community. So I hope that answers your question. I would check with your department and see, depending on the job, but there are jobs that just cannot be done remotely. And that is a problem. And that is one of the concerns. I am very, very concerned. I don't know if it's coming across, to lose 45% of our childcare when that's not enough right now. I know families that scramble, especially to get the highest quality childcare for their precious little ones, So I think we're all feeling this, and I guess I look at this as also an opportunity, that this crisis brings this problem out in the open to all, even if you don't have children, that you're trying to find childcare. I hope that this helps us to be more creative in our thinking of how we move forward. yes, we have to address the short term, but we have to move forward knowing the challenges of this program and knowing that the science tells us that we cannot lose ground. These are our precious little ones, need all this support, and their families need this support for our whole community's long-term health.
Yeah, that's very helpful. Thank you.
Any other questions or comments sharing your experience?
So I have a question for all of you, really, and it's more along the lines of, if the childcare industry is really struggling right now, would we then see a rise in the gig economy where programs like sittercity.com and care.com become more important? And then the other question would be, well, it's not really a question, but it's more a statement. So we run 2 restaurant companies, Rapid Fire Pizza and Hothead Burritos. We have a number of restaurant managers that have little ones, and obviously if they can't come to work, we can't open the restaurant. So it's severely crucial that they have access to childcare. So we contacted, I think it was sittercity.com, and we basically talked with them about different programs they had available, where if we had a restaurant manager that had an emergency situation and had to get to the restaurant, they could call a backup babysitter, basically, that would be available on call, kind of like a Minuteman. But the price was ridiculously expensive, and it's not something we could swing right now. So I guess I'm just asking, could you all just speak to that and let me know what you think? Kind of a broad question.
Thank you, Sarah.
So maybe I'll start and then my colleagues can add in. Yes, I do think people are going to have to think creatively. It is something we're concerned about because we know there will be more children in unregulated, unlicensed care, and people who are leaving children with, you know, a 13-year-old, a 14-year-old who really isn't in a position to take care of young children all day, every day. So we're very concerned about the safety of our children as people get creative and think about other childcare options. I mean, certainly the care.com, the Sitter City, certainly you can find high quality people, but I know, speaking for myself as a parent, I would feel very uncomfortable leaving my child with different people all the time or a last minute. So I really, obviously that's not a long-term viable solution to stabilizing your workforce. And just to help you understand, I sometimes I think stories help tell a picture of or help paint the picture a little better. I spoke to a single mom in Montgomery County last Friday who works for one of our well-known healthcare systems, and she has a 6-year-old son, and she was desperately trying to figure out how she's going to have childcare for him next week. She's been working during the pandemic, and during the pandemic, she was able to figure out how to make it work. We had the tuition assistance that we were offering in that, but her provider is increasing the rates starting next week, and she can't afford it. She makes $15 an hour, so better, sadly, than a lot of our childcare teachers even make. But obviously, you know, $31,000 a year gross income. She does not qualify for any state subsidy for childcare, and her tuition is over $10,000 a year to pay for her child. So you imagine she's going to take a third of her gross income to pay for childcare. I mean, this just, the math doesn't work for families. And Julie can attest that the $10,000 a year is not even enough for the childcare to provide high quality care for that child. So it's just, I share that example because we have this problem in normal times, and now it just got 100 times worse because you literally cut the capacity in half or more. And now providers are going, I need to double or triple my rate just to cover my fixed costs and my staffing costs. There's absolutely no profit in that. They're just simply trying to cover their costs. So I think we do have, I mean, this is a long-winded explanation of kind of what you're talking about. I appreciate that you're trying to figure out how can we use these other sources, but I think using our childcare programs that are licensed and regulated and that we want to be there for the long term is the best solution, and figuring out how we supplement those providers and make childcare accessible to them, I think is a better systemic long-term solution than trying to use some of these unlicensed, unregulated care options.
I would certainly agree with what Robyn's saying, and I think it's important. A couple things that maybe we haven't talked about yet is this. Yes, we've talked about capacity, but the advocacy piece of what Lynanne's talking about has to happen. You know, we have to expand capacity. We have to live in these reduced group sizes for as short a period of time as possible. There is concern about what will the impact of coronavirus be in childcare centers. But I would say we have experience from the temporary centers that does not look like a prison or a nursing home. And I think there are assumptions being made across the country, quite honestly, that it will be the same in childcare. And I don't think that's been proven to be true. So I'm hopeful that June and July perhaps are the shortest amount of time possible. And maybe by August, as the state has to figure out how do we reopen schools, then we, early childhood is part of our education system too. So we have to think about quickly expanding capacity to eliminate some of these challenges. It certainly was kind of a slap in the face, I think, to a lot of businesses when banquet centers and weddings, you can have 300 strangers attend an event and you can't allow more than 9 preschoolers to be in the same classroom. So I just feel like there's some recent policy decisions from our state that do not make sense and that are making a difficult situation even just almost unbearable.
I think I could just add on the, if we don't have time, that's fine. I was just going to add on the, to the original question. I think as advocates, we have always really wanted to create a continuum of safe and high quality choices. So I think, the decisions that different families make, we always trust families with their kids, right? Like that parents are making the best decisions for their children at the time. But we recognize that if we are, even when we're trying to find those solutions outside of unregulated care, first of all, while they are often daunting or scary because we don't have these trusted relationships with folks on care.com or others, that those built-in or organic healthy relationships we have with family or with neighbors are eliminated by many of the risks of the virus. So staying with grandma is not necessarily an option any longer. And while there may have been some temporary fixes in terms of folks not working, as people go back to the workforce, those are being eliminated. And I think our state system and really across the country has never really done a very good job of acknowledging what we call in the biz family, friend, and neighbor care. Because many of those circumstances are high quality, the foundation of high quality in terms of relationships with adults and children, consistent relationships, thinking about how, supporting extended family and neighbors who are like family to care for children is a really good thing. But from a capacity perspective, like we absolutely have to have that continuum of choices and bringing along these other kind of options and systems to be inside of our supported, we say regulated, but really a supported infrastructure of state care, I think is really important. So we know where these kids are, because like to Robyn's point about the woman who can afford childcare, our conversations pre-pandemic were we have to expand eligibility because there's a whole segment of the workforce that is choosing not to work because it doesn't make financial sense for them because they don't have access to any childcare help, whether it's subsidy or any type of support to take kind of the the sting off really the very high cost of care. And so where some of us could operate in the marketplace on a care.com scenario to have a private nanny or what have you, the prices are very exorbitant. And while I think we all have to be creative, we can't lose sight of child development in making all these decisions. So any kind of temporary options, any additional transition for a child, particularly where families don't have consistent networks of support and kids are bouncing around from different places, is not good for children's development and building those safe and secure relationships. So even my little guy who's been at home with me, it will be a transition to go back to the very trusted center-based care that I have and that I'm anxiously awaiting to open on Monday. But that's still a transition for him. So thinking about, a day with essentially a stranger in an emergency situation, that's not what we want for our kids, and parents shouldn't have to make those choices.
Thank you all. Well, I want to be respectful of time this morning and just give our panelists a few minutes to provide some closing comments, if there's anything they want to leave our participants with, and then I'll wrap things up with a little bit of the Chamber's perspective. So our panelists, is there anything you want to leave with?
Well, I would just say that, we are on the cusp of a very important development. Obviously, the next month or two is going to show us a lot of things. And uncertainty is for everyone. We don't know. We're opening up. We don't know what that's going to be like. We don't know how all of these programs are going to deal with these new requirements. I mean, we don't know more than we know. But I guess I'm an eternal optimist that if we pull together, that we can be a force for what we need. And so I just ask everyone to do what they can to one another, and that we work together. The county will do all that we can. We've been hit with budget cuts too, so we're no different. But the cause is so important, and I find it so fundamental, not only to our short-term recovery, but to our long-term health as a community, that this is not an issue that we can ignore or think it's going to go away or just solve itself. So I just ask everyone to become an advocate in your own way. And if we work together, I truly believe we can figure it out, and we may make mistakes along the road. But I think for our children, that is what we must do. So I'm ready to work with anyone here to be that voice. And I hope others, and I once again want to say thank you for everyone who spent this hour talking about this important issue. I really appreciate the Chamber bringing it, because I think if we add business leaders to the equation of what this means to their workers, it will be that much more powerful and compelling to our legislators. And we need everybody in this fight.
Thank you for your work, Commissioner. Thank you so much.
I agree. Thank you, Commissioner Rice, for your leadership and support. It really means more than anyone can express. I think one piece that hasn't been talked about, and isn't to reopen the whole conversation, but the childcare workforce itself is very fragile. And that is going to be another fundamental problem to solve as we move forward here. Yes, childcare is expensive, and yes, childcare workers are notoriously underpaid and undervalued. And I just keep thinking we've got to stop putting Band-Aids on things, and we have to think big and dream big, and we have to come up with new solutions for the entire funding mechanism. This is education. Education does not begin the day children enter public school at kindergarten. And once and for all, we have got to communicate that, advocate for that, and really have the entire society believe that and understand how important this foundational period is for the future education and then the future workforce for every business. So I again appreciate the chamber and all of you, participating in this conversation. Thank you for the opportunity to also participate.
Great, thank you, Julie. And I noticed, Lynanne, you put a link up in the chat box. If you'd like to explore the Groundwork Ohio website, please check in the chat box to sign up for that newsletter that Lynanne mentioned. And Robyn, did you want to add something?
I just echo everything everyone's already said, and my last request would be please take a minute to do the advocacy tools in Groundwork. It takes less than a minute, I promise. So I've done it myself, and we need quantity, and we really desperately need business voices, because childcare can't advocate for itself and get investments on its own. We have to have people outside the childcare education industry advocating, so your voice really does matter and make a big difference. So thank you for taking time to be part of this.
Great, thank you, Robyn. If you'd like to see an example of one of those letters, the Chamber has done some federal advocacy on this issue. So we do have a letter on our website that we sent to our federal delegation. I really want to thank all of our panelists for their time this morning, for shedding a little insight on some of these really big key issues. We talked about access, we talked about quality, we talked about affordability. I know that's not the end of it. And really, I share Commissioner Rice's optimism that there is a lot of opportunity in the crisis that we find ourselves in to look at how we can transform these systems that really, as Julie mentioned, have been struggling for quite a while. And we know the way that our economy is structured, how interconnected we all are. And even if we don't have kids ourselves, the idea that this is impacting our workforce as a whole, the future of our community, is so critical, and I think was made really apparent today. So thank you for sharing those insights. I want to thank everybody that joined the call to share a little bit about what they're experiencing. I know we as a chamber, this will continue to be an issue, a major component of our policy agenda, and so we look forward to working with each of you as we start to identify some of these creative solutions and hopefully come out the other side with a really robust system that supports the businesses and families in our community. So thank you so much. And with that, I will wish you all a great day and look for an email from us a little bit later that will have a recording of this webinar if you'd like to catch up with anything. So thanks so much. Take care.